The Nigeria Center for Disease Control says it's monitoring emerging evidence on the new COVID-19 variant known as Omicron, which was first recently identified in Southern Africa. The new variant is considered highly transmissible and has already triggered a new wave of travel restrictions targeted at countries in Southern Africa. However, the NCDC, in a statement signed by its Director General Dr. Ifedayo Adetifa, said, quote, "The fears about its ability to evade protective immune responses and its being vaccine resistant are only theoretical so far," end of quote, while noting that the WHO and researchers across the world are working at speed to gain understanding of the likely impact of these variants on the severity of COVID-19 and on the potency of existing vaccines and therapeutics. The NCDC urged Nigerians to take necessary precautions. It also reiterated the need for citizens to adhere to public health and social measures such as the wearing of face masks, hand washing, and physical distancing. Now let's talk about this new COVID-19 variant. We'll have a medical doctor, Wasim Akorthis, who is joining us from Abuja. This is coming at a time where we think businesses are beginning to recover and life gradually returning to pre-pandemic periods. Are we likely going back to another pandemic with this deadly COVID-19 variant?
That's most likely. But we have an advantage now that this new variant of the COVID-19, the Omicron, that was discovered, has not been seen here in our country. None of the citizens has been tested positive here. But if we continue the same way we did last year, by not adhering to the NCDC, we are most likely to have it here in our country too. But for now, none of us have been tested positive yet.
Well, you will be surprised because we have a lot of people who do not believe in the existence of COVID-19 at first. And when you tell them about Omicron, they'll be saying this is nothing but a hoax. What do you think can be done to change their belief that truly there is COVID-19 and, as a matter of fact, Omicron?
It's all right. This is one of the measures that can be done through media, and the Nigerian Center for Disease Control has been releasing a lot of write-ups since the 24th of this month, informing the public about the discovery of the new variant and then other awareness that can be created too. And earlier before now, the citizens were advised to take vaccinations. That is, everybody should present themselves to be vaccinated. So these are various means that can be taken to inform the public. Like you rightly said earlier before now, that it's highly transmissible, and some proposed theories are telling us that the vaccinations that are on ground now, this new variant has been resistant to them, and it has about 20, it can be mutated, about 20 mutations, the ability to mutation. So it's very, very highly transmissible. So I believe that the country and the Nigerian Center for Disease Control should take more measures to inform the public that this is real. And if we don't take caution, it's going to be worse than last year.
Well, we'll see what people will be doing and what the response of the government, both in Nigeria and in the world, what they'll be saying to Nigerians that they should be vaccinated, even though when we are thinking that this vaccine, or they're already saying this vaccine, might not be effective against Omicron. Medical Doctor Wasim Akorthis, thank you. It joins us from Abuja. Thank you so much for our insight.